All right, welcome to Early Care Connection. I'm Izzy Greenberg. Today we are joined by our usual panel of experts, Meryl Gay from the Connecticut Early Childhood Alliance and Ava Bermudez Zimmerman from Child Care for CT. Today we are also joined by Commissioner Beth Bai from the Office of Early Childhood and a team from the Office of Early Childhood to help break down the Early Childhood Education Endowment, the exciting child care legislation that has passed through this legislative session, which ended on June 4th. So we've got a full morning, some other updates for you. So we will just get started. Commissioner, I'm going to pass it right over to you. Folks, before, as we start, I will share the link to the presentation in the chat. I will share it in English and Spanish. Always the disclaimer, which is that we use a robot translator to translate these slides because it saves a lot of time, but it is a slightly imperfect translation. Everything might not be as good as if a human did it, but it allows us to make sure that everything does get translated. And so we appreciate your patience with any funny translations. And then a quick reminder to use the chat for conversation between each other or technical difficulties. But if you've got questions for our panelists, to please put them in the Q&A. And I'd actually respectfully ask that folks wait till the end to put questions in the Q&A because your questions might be answered and then it will be hard for me to wade through them. So just wait if you can. All right, Commissioner, welcome. Thank you so much for being here, to you and your team. And I'm just going to turn it right over to you.
Well, thank you, Izzy, so much. I'm happy to be joined by Elena Trueworthy and Maggie Adair, two core members of our leadership team as we worked on SB1 and House Bill 5003. But I really wanted to start today, Izzy, Ava, and Meryl, and everyone on this call. This is a moment for us to pause and be grateful that these two bills passed. They are truly transformational bills. And I am convinced that this Monday morning call that started during COVID, but brought people together, gave OEC a place to come to hear feedback, to get questions that drove our policymaking, to talk about the bills when they were starting, to build advocacy coalitions. I think this is one of the major things that's different in Connecticut is this organized advocacy coalition. And it has so much to do with what happened in the House and the Senate and eventually when the governor signs this bill. And so I'm a little verklempt, just thinking about all of you who come on despite your busy days, trying to cover classrooms, putting things together. You have said, this is bigger than just my program. You have gathered in community. You have advocated for everyone, whether you are a state-funded center, a private center. We know that for decades, early childhood has been underfunded, and the workforce has been subsidizing families and the system. And we believe that this bill, when fully realized, will stop that. So just thank you. I think I have to start with that before I get into the details. The biggest detail is this happened because of community. This victory has 100 mothers. And this particular group has a lot to do with it. So just thank you. So I'll get down to business, but pat yourselves on the back, everybody.
Yeah, and let me add, though, that if the Office of Early Childhood had a crappy team, this would have been a lot worse, a lot harder. So this is a two-way street. This is a huge advocacy partnership between a lot of willing partners, including our governor, including your office. I mean, including our community here. And so the stars aligned for us.
Yeah, exactly.
So everyone deserves to feel really proud of this moment. So
right. We had to build trust with each other. I mean, I think that was a key part of it, but without a communication channel, you can't build trust, and we have to keep earning that trust. So anyway, here we go. So
okay.
now we'll talk about the details of these bills. I'm going to share my screen and just make sure that you all can see it. Can you see my screen?
Yes.
We can see your screen.
Awesome. Okay, so this is a rundown of the bills. Let me just sort of set the stage for you all. I think, the work that happened, for the year and a half prior to now around the Blue Ribbon Panel, and all the work on Early Start Connecticut is part of what brought us here. We have been building on guiding principles, and this these bills were built to, in combination, address challenges in the child care system. So you'll remember this slide, those of you who've been coming on the calls, because again, before we introduced the governor's plan, we came to you and said, here's what we plan to introduce, and sort of laid out the problems and the issues. So these are the problems that we were trying to address related to making sure all children and families had access to high quality early childhood programs. But also the problems you'll see are those that we identified in the Blue Ribbon Panel process and those that were reinforced throughout the past year. I think the guiding principles are super important. I'm going to spend a little more time on these because hopefully what you'll see is these guiding principles translate into the bills. A lot of times with early childhood policy, states just say we're going to do universal preschool, and they slap preschool onto elementary schools. And that just hasn't been terribly successful. The states that have had success have had a mixed model where we believe it's family childcare, public schools, public-private partnerships that make this work. So we do think that's important. And as we've been signaling since COVID, we do believe in quality standards and having those standards in place. I think the work of this organization made sure that infant and toddler care was supported more than was in the original bill. I think that was an improvement based on your feedback. These bills do accomplish workforce compensation and align with public schools for 2027. Also, the first 2 years will be planning. And I think that's important in the talking points when people are out. I mean, because, I know my children were like, oh my God, this is going to be such a help with childcare costs. And I go, well, your child will be in kindergarten when this comes in. So just there's time for the fund to get bigger and for the planning to happen. And I think parents have a role because of the way we form the boards. And it was a really good collaboration between the House, Senate, OPM, and OEC. We're really lucky at OEC to have Holly Williams as our OPM analyst because she problem solves with us and is just a great partner. And I think, that had a lot to do with all of our planning. So Senate Bill 1, these are just the keys of what is in Senate Bill 1. This idea that there's an endowment up to $300 million. And this year it will be between $200 and $300 million, but it will regularly be the unallocated surplus that will go into this fund. They'll figure out what that is in mid-June, and then by the end of June, put the money in the fund. And so I think that's where this group is going to keep coming in. On average, this is more than $400 million a year is in the unallocated surplus if you go back 7 or 8 years. So 300 million, if we had the average, it would be 400 million a year. But for the first year, it's up to 300 million, depending on the surplus. And that will change each year. The OEC can spend 10 to 12%. It's going to be 12% the first 2 years and 10% after that of that endowment. So the good thing is the money's going to sit there in the bank getting interest, and we're allowed to draw down, but then every year money will be put in. So this is what makes this plan so different and makes Connecticut's plan a sustainable way to support early childhood. So it's not fighting every year to say, oh, we need more funding for rates, or we need more money to serve more children. This money will be in the fund specifically designed to keep it affordable for parents, to increase the rates, and to expand access. So I think it's, Governor Lamont had a really good idea for ways to do this. And so I think it's going to work really well. The other thing that we worked on in negotiations is we wanted to be sure in the appropriations budget, they just use this fund to pay for care for kids. And the whole point of this fund is not to take the place of the general fund money. We still have to fight for dollars there, and we'll still make our requests there. This is meant for new initiatives to improve wages, reduce rates for families, increase the rates, that we pay, and expand access. So I just think it's really important to reiterate that, and going forward, that this group reminds the legislature of that promise and language about you can't supplant what's already being done. These are the items that the endowment can be used for. This is expansion costs. And when Elena and I and others were in the negotiations, we wanted to be clear that expansion costs are not limited to more children, that the way you get expansion is you pay at the full cost of care, that you then expand, and that you expand infant toddler as well as preschool. So higher provider rates are included in expansion, so we don't get caught up in this what's happened for 3 decades, which is the fight between, do we want to serve more kids or increase the rates? And this is like, no, we have to do both. And we start with affordability for parents and rates. And after those are taken care of, we expand. So again, something very different about our approach in Connecticut. And Elena, you'll remember when we said with the Senate and the House, that's how we were starting. It was like a moment when we were all like, wow, right?
Absolutely. There were a lot of those wow moments, but that was a big one for sure. And I think in here, an important point in this first one is increase slots and access through Early Start Connecticut, right? The idea is not to build a different system. It is to stay along the pathway that we've all been building together, which is Early Start Connecticut.
Yeah, that's a really good point. And the other, I think, important point about expansion costs is we also mean expansion to other state programs, private programs,
Exactly.
public schools, that this is not meant to just for the system that exists. This is meant to build a more of a statewide system. And as the fund grows, more and more communities, more and more programs, hopefully will participate in Early Start because of paying at the rate of the cost of care. Our modeling, when we did it on the spreadsheets, just brings in more and more centers and programs and family childcare homes each round of the RFP. There are programmatic costs, so that does include, because without the workforce, you can't expand, right? And this also includes more funding for towns for local governing partners, which, that work Elena's been doing. The challenge has been we didn't know if the endowment was going to pass and if the endowment sort of language would allow us to use the funding for local governing partners. Again, it's only used to enhance what we're doing now, so it can't be used to replace. So that we're glad there's some dollars to enhance that. I don't know, Elena, if you want to add anything there.
No, just that there's a lot of work happening on the ground with local governance partners. And so just want to thank everybody for the efforts that have been going on, and more communication will be coming out pretty soon about LGPs.
Great. And I think thank people for their grace and understanding as we're building something new. Again, very Connecticut, not regional, not statewide, but local. So it does take, building on the strength of the councils that we have, coming up with an approach that will be successful. And then there are administrative costs at OEC, for the staff to run the programs, for the data systems, et cetera. This again, starting in 2027, not now, families who make less than $100,000. This will cover, and I should also say this will cover the school day, school year portion of their tuition, so that's all free. And then there may be some wraparound with Care for Kids or with parent fees. And then there is a infant toddler actually is full day, full year. It's based on full day, full year, our calculations, but preschool is school day, school year. So all those details we'll work on and talk with you about through 27. And then that families either pay nothing, or after $100,000, they'll pay 7%. And in Connecticut, the average parent pays 16 to 20% of their income on childcare. So this is a huge savings for families. This will help them buy homes. This will help them have cars. This will help them get to work this will help them have that stability that we know children need, that poverty interrupts because parents are trying so hard to stitch things together. So I don't think we can underestimate the value of giving parents more affordable childcare. Even the difference in the child that's going to arrive at the door to our childcare when that parent has more stability because they can work, because they have more money in their pocket to do things like support stable housing. There is an advisory board as part of this, and it will be tri-chaired by a member of the House, the Senate, and the Commissioner of OEC. And the Treasurer's Office is very involved in all of this because that's where the money will sit, and they will administer the advisory board. And then OEC has to, there's all kinds of things around ongoing, checking what's happening and how are we doing. Elena did this good thing when she put a star on anything that's available to everyone in the field. So while this is very focused on expanding early start and the state funded system and building that out, there are pieces that to the House and the Senate and to us were important that touched everyone. This one was particularly important to Representative Farrar, and there will be a health insurance pilot to where we'll put $10 million in a fund to help support the rates that providers pay for Connecticut's Maggie, I'm forgetting the name, the exchange, right? The
Exchange.
Connecticut Health
Right.
Exchange.
And there will also be, the exchange will also be doing an analysis of what is the need among the girls at the field. Because right now, we don't know what the need for healthcare is. So that'll be an important first step in that first year, along with the pilot program.
Right. The first year, I think there's $300,000 to do that study. And the second year, the 10 million will go in the fund so that any childcare providers on that program will get a reduced cost care. Okay, House Bill 5003. So one of the pieces that you all have been advocating for, and this came from all sides, was to improve our coordination and parent access to services. When we went and listened, I mean, it was really striking listening to parents during the Blue Ribbon panel process and listening to parents in our parent cabinet about the ways they were accessing early childhood. And many, many families don't even know there's a state-funded system. So they didn't know there were affordable childcare options near them. Meanwhile, seats were sitting empty in some programs. So this crying need for, this is 2025, people, we should be able to get this together. The push for a portal that will have the information needed to help families find care, to let programs say what spaces are open, to help determine eligibility, to link up public schools, Care for Kids, and Early Start, where parents just see their options. It became very clear during the Blue Ribbon panel process that it's so idiosyncratic how families find out about what's available. So that is an exciting thing in 5003. And this will help all providers. Whether you're in the state-funded system or not, families will see if you have an opening and what your hours are, just to help with marketing. Right now, we have, just thousands and thousands of program marketing on their own. So we will work with other agencies on the portal, and also this portal will be available for all providers and all families. And this is just you remember when we came before, those of you who were here, this is our goal, is to have more of a funnel into the system. Also in this bill, it's saying that by July 1st, 2027, OEC needs to do prospective payments for Care for Kids, which is a goal that our CCDF team, the Care for Kids team at OEC, is working on right now. But we know from the past year with Early Start that paying people upfront makes a big difference in hiring staff and financial stability. So we're going to try to improve Care for Kids that way as well, based on this bill. We're also going to have a pilot for large family childcare homes. Again, this is something we heard in the Blue Ribbon panel. When I went and talked to family childcare providers, they're like, we're ready for more. We can serve more, but the rules are so complicated. And so this is our attempt to sort of try to increase the family child care size with a special endorsement and just have 30 this year and see how it goes. So we're really excited about this. And then there was 7288, which was the bond bill. And this bond funding is available to all programs as well, where there will be a child care facilities program and bonds issued to improve child care facilities, to expand classrooms, et cetera. I think it was 11.8 million this year, Maggie, that the agreement is will go on the bond agenda.
11.7 million for
11.7 million.
through FY31, and then FY32, it's just 11 million. So it's a total of 80 million over 7 years.
Okay, but I mean, what we can do now is agree to put something on the bond agenda this year, Again, this is why we need this group, because there'll be new governors, perhaps, hopefully not too soon, but there'll be new legislators in place. We need to just keep the pressure on that those bond dollars are important, because again, without the workforce and without an ability to expand, we're not able to add, 20,000 kids. So that is the end of my slideshow. We'll stop sharing, and I hope that was quick enough, because we wanted to leave time for questions.
Yes. Okay, so first question is easy. Can slides be shared? I shared them in the chat. I will reshare them. So I will share
Okay.
them in the Q&A for folks.
That was easy.
No, excuse me. Have we thought about how lowering family fees will impact programs with less Care for Kids income coming in?
Yeah, the whole point is in 2027, the rates will, starting in 2027, Care for Kids will not be part of the system. There's just the parent fees and the OEC paying at full cost. So like, for example, it goes from, I think it's 10,500 now for preschoolers to 19,000. So when we did the calculations, we built in the lost revenue, if you will, from reduced parent fees to getting to that 19,200 number. So the rates make up for that.
Thank you. For the early start CT expansion funds, 35% for infant toddler slots, will there be an RFA process to bring on new providers? In cities like Stanford, we have only 1 to 2 providers with early start slots now. We really need a way for new providers to be selected and included. Also, for providers who are already applied in a past RFAB, will those applications be considered? Will we need to reapply? We want to make sure this process is equitable across all cities. Thank you so much.
It's a great question. We did give extra points in RFAB for new providers. We got a lot of new family childcare providers in RFAB. We did not get we got some new center providers, but not that many, because even though we gave points, extra points, so if you're a new provider, you got like 10 points, I believe it was, something like that, in your scoring. But sometimes that was outweighed by another center in the community was located in a lower income area, may have been accredited, may have had teachers that met QSM. So because there are a lot of variables that go into an RFA, I think that the current programs are cited in general in the highest need areas. And so that could get them 20 points right out of the bat, which outweighs the points for a new program. So we are thinking through ways for the next RFA to, think about how we can better add new programs, because that's the whole point. We want to expand further out than the current providers. But that said, equity and the higher need communities, the high deserts will continue to get funding first, if you will. That's the priority, the highest need areas. But as the fund grows, more programs can come in, et cetera. In terms of using the RFAB, what we will do is we're working with OPM to figure out the rules, but functionally our hope is to just keep going down the list, because there is some money for new spaces in the first 2 years, to add 600, probably 600-ish new early start classrooms for, fiscal year 26. Now, this fiscal year that starts July 1st.
Classrooms or slots?
What did I say?
600. You said
600
classrooms.
slots. Oh,
Slots.
classrooms would be amazing.
Yeah.
I see Elena and Maggie leaning forward. Whoa, back off, girl.
Okay, yeah, that's a difference.
Yeah.
That's a difference. I also, it obviously goes without saying, but when you want to talk it through these kinds of processes, this is a great spot, because anytime I ever think something is a great idea set, we're good to go. Anyone comes here, and then the providers say, but here's how it'll affect this. Here's how it'll affect that. And it's always this nuanced conversation. So I know I speak for this community to say we're always happy to provide that level of pick apartness or front to end conversation. So all right. So Debbie is wondering, if we currently have health insurance for our employees, how will it work? We currently pay 90% the cost of health insurance for our employees, and it can be very costly.
Totally. So this is why we have the first year to figure this out. During the pandemic, we tried, and we're really out of our depths on this. So Representative Farrar has been working with the Access CT, and they'll definitely be coming on a call and having focus groups and listening about how to make this 10 million available to help the most possible providers.
And if a program provides and funds a group plan for their staff, will they have the opportunity to participate?
Well, I think that Access CT has group plans. So, that's the whole point. We've got to figure out. I know I can give you my example. When I was running a nonprofit, I tried to bring them in to figure out how to help me use Access CT to give, and it was so confusing. Meanwhile, my insurance agent walked in and said, here's what we're doing for you. Here's your plan. Here's what it'll cost. Done. And so, as I understand it, the system has been improved significantly in terms of helping at a group policy level. But I'm just saying, as a director, I understood it was much easier to just buy my plan from a collective than go through Access CT. So that's what this year is about: listening to providers the first year, figuring out where they're getting their insurance now, and if a shift is going to help them.
All right. We have two questions about the mechanics of the endowment. And then actually, Meryl, let me just say, after that, I'll turn to you if there's any particular questions you want to ask, and then we'll keep going through this. So the two questions about the endowment: one is it a true endowment that's invested in the market, or is it a savings account? Given the ups and downs of the market, the varying amounts of funds which will be put into the account each year, and the various uses of that account, how will it be managed to ensure that there is consistency from year to year for the items such as provider rates and slots? Are they going to jump up and down each year when the endowment does not produce enough to cover the prior year's levels? And then the sort of second question is not at all asking you to be prescient, but because let the interest grow is such an important talking point, what kinds of numbers are people expecting, even at its most conservative?
I think this is such a great question, and I've had so many questions around this, so I'm glad this person is asking this question. The point of an endowment is we're going to put, say, 230 million-ish, in this year, and I won't know the number for another week or two. But let's say we put 200 million in this year. We would anticipate next year to be between 300 and 500 million based on the averages. So the money goes in, and OEC with an advisory board has to make a plan to do the things we said: pay teachers on parity, to reduce rates for families, and to expand spaces. So we can't build anything this year that would use more than 12% of that fund. So we'll take 12% to do those things we said. And then the fund we're planning on an average of 6% based on the treasurer's office, and they will manage that. It does not managed by OEC, it's managed by the office of the treasurer. They will invest it. They have to invest it in fairly safe items because of the rules of investing state dollars. We're counting on 6% a year. So now we spend 12%. We get 6% interest. Right now we're still down 6%. Next year, more money goes in the fund. Again, until we know what that is, OEC cannot make a plan that the current amount in the fund can sustain. So let's say it's, $190 million. Our plan will match that $190 million. And then as more money comes in, it'll be bigger. If no money came in, we have to be sure that we can maintain the current providers, the current rates, the current costs for families, and go forward. So that we would be able to sustain. Again, we can spend 12%. For 2 years, we can spend 12%. After that, only 10%. So each year, the thing about this endowment to understand is it's designed that each year there's a deposit. It's not like somebody said we're putting $1 billion in the bank and we're going to spend it down. The idea here is we're putting money in the bank every year, whatever's left in the unallocated surplus. That is growing with interest, and we're spending likely 4% more on average than the interest will support. So that is where it's important that the money's coming in every year. If the money, just say there were 3 years of zero, then we wouldn't expand, but we would continue to pay at the cost of quality, all the things we're talking about now. We just couldn't expand it. So I think people worry because of what's been happening with the markets, et cetera. But that's the hope. This is a savings account in a way that is invested, and we certainly can't spend it all at once. And we fully expect that each year there will be some unallocated surplus.
Thank you, Meryl. Excuse me. Meryl, before I go to you,
Yeah.
let me just say, Ava, your audio is cutting out on interpretation. Ava is taking a quick, Sandra's taking a quick break. Ava stepped in, but it's chopping out a little bit. So Ava, if you could fix your audio for our Spanish listeners. Thank you. All right,
Okay.
Meryl.
There are a bunch of questions from family child care providers who are interested in how are the 30 programs that are going to be able to go into the pilot going to be chosen? When will that happen, and all that sort of stuff?
We're working some of that out. Maggie looks like she's ready to answer. Maggie, what do you got?
Well, just I want to say that those 30 slots are really statewide. And the licensing team is going to be working on the application process over the summer, in June and July. It takes some work to get this prepared. And just one point that people have to understand, you have to be a current licensed early childhood provider to get this, go for this next, apply for this endorsement. That's a key thing to remember. We want to make sure that providers are already set and understand the rules, are operating their businesses, are stable before they try this new pilot, or to ensure success.
Thank you, Maggie.
Okay. There are also questions about for programs that have some early start slots and some private pay slots. Sort of how's that going to work in my program? And if the early start, program is going to pay enough that I don't need to use Care for Kids, can I still use Care for Kids for the other kids?
Absolutely. Absolutely. You can use Care for Kids for the other kids. And, we have until, July 1st, 2027 to get a lot of these things worked out, but we love a mixed model. We love when there's some slots that some are early start, some are not. Could be you have enough kids for an early start classroom, or you have 18 across your program, and that is sort of the equivalent of an early start classroom. I think, one of the challenges is going to be that for the RFP for 2027, and I don't see this as a challenge, I see it as a good thing, is teachers that meet the credentials for a lead teacher with a bachelor's need to be paid on par with public school teachers in that program if they're going to get the 20 grand per kid or 19 something per kid. Now, if that's only a small portion of your center, then you're thinking, but that's just one classroom. So we're going to have those conversations with the field. But to be honest, there are some programs that are already paying teachers on par with that. Those who can pay enough full pay, have enough full pay parents, are paying head teachers better sometimes, unless they have a profit motive. So I think we need to listen and work some of that out for programs that have the mixed model, because we don't want to create a segregated system. We want the system to grow and be in more programs.
And so this is going to pay, if you're in a school day pre-K classroom, or you are using pre-K for school day, it'll be free. For those other hours for working parents, that will be paid for by the parents
Or
on.
Care for Kids,
Okay. And so on a sliding scale, if I'm under 100,000 and the school day is free, then the afternoon, is it a maximum of 7% of my income, or what is it?
Well, it depends if it's part of early start, so if the afternoon, and some of this will depend on the community plans. If the community plans call for a lot of full day spots and not part day, not school day slots, that will change things, and it will be the early start supporting that. But if it's a school year, the wraparound could be paid for by early start, quarter time, or Care for Kids. It's a lot of stacking.
Okay.
So I think, again, just this morning, Elena and I were on a call trying to figure out the parent fee, because we also really want to encourage programs to do part week spaces, 3 days a week matched up with 2 days a week, because we know families' needs have changed, again, from our listening sessions. Many need 5 days a week, but not all. And our system is so tilted toward, in terms of the early start, full day, full year. So as we look at there's so many more options, but it makes it more complicated for providers to do, part week, share a slot between two kids. But it is what families are needing. And just like the stuff you're talking about, stacking the hours depending on the program will be complicated. So we've all got to work together to simplify that as much as we can.
So I'm seeing some questions that are sort of I know what I've got now, and this is something different. Is it really going to be better? Tone of, for instance, I'm worried that it's going to, whether the rate increase is going to be big enough to actually replace parent fees and Care for Kids, and still give us enough money to pay our staff.
Yeah, we really tried that math out, and I mean, certainly our models show that yes, it is. We're open to feedback. The thing about Care for Kids is only about 20% of the slots do people have both Care for Kids. So at least 3/4 of the spaces are just this money.
Just
So
the early start money.
just the early start money. So 3/4 of your population is getting double the tuition. And then you have this other quarter, say, which is probably less than that, but this other quarter, which is at that same cost, you still have way more money.
Yeah.
You know what I mean? 75% at double and 25% at the same leaves a huge difference.
Yeah.
And again, if the directors want to like put together a budget and say, we're looking at this and here's what we see, and help us understand, or we want you to understand, we're open to that.
There was also a question about the proposed compensation schedule, unanswered questions here. Basically, do administrators get a pay raise too, or is this just teachers? I think is
Well, the bill speaks only to teachers, but again, the dollars coming in are so significantly more. I mean, if an infant toddler space, just about doubles in revenue, that helps support administrators getting what they deserve. But that is not outlined in statutes. And, I think it might be time for like a director's connection to advocate for their needs, because I think we've been very singular focused on the workforce, but without good program leadership, and compensation, so they might get together and say, oh, we need a bill next year to say, wait, we need compensation as well.
Do you know if the health insurance will also support people's families? Like, can you get a family, if you're the person who works in your family, will your children also be eligible to be covered, or is it really just for the provider?
I do not know, I'm sorry.
That's a good one to
I'd
figure out.
have to ask
I
Rep. Farrar.
don't think that's answered yet either. I think that is going to be part of this first year planning process.
Thank you.
It's not specifically stated in the statutory language.
Okay, great. There's a 3 cheers for a directors forum. And maybe we can do that on a Monday here too, is just say we're going to focus specifically on those needs. Also, I don't know if the Office of Early Childhood team can answer any of these questions in writing. We'll never get all 42 answered live. So that would be really helpful if you guys can go through.
Yeah, we'll do our best. Yeah.
Meryl, sorry to interrupt you on that one.
So there were also some questions about sort of the requirements to be an early start program. Does every employee who works in the program need a bachelor's degree in ECE or?
No.
Yeah. So.
No, you'll recall last year we passed legislation that allows people with associates to be lead teachers and qualified lead teachers. There were some items in the bill that we didn't put here because we couldn't put everything here, but upon the next RFP and in probably the winter of 2020, the 2027, between January and I'd say March, there'll be an RFP probably in that range, maybe December to March. There will be a requirement to participate in the child and adult food program, which was important to the Senate, which will have a waiver process. There are programs that don't have kitchens that, just would have to apply for a waiver and say, how are you making sure the kids are getting nutritious food? We're asking for participation in Elevate, which is the quality improvement system, to get accredited. I'm trying to think, were there any requirements I'm missing, Elena, or?
There was, I don't think it's necessarily came out as a requirement, but a focus on business supports, right? And really ensuring that centers, family childcare homes, others that are, they have solid business supports available and that they're taking that into account.
So you've mentioned the increase for the full day, full year preschool rate up to 19,000 and change. There's a question here about what about the school day, school year programs? What kind
Well,
of?
those go from like 6,000 to 10,500.
Okay. And then another question about the large family childcare, whatever we're calling it, endorsement. Will those programs have to go through local zoning like they do now with group family childcare?
I believe so. Maggie, I'm looking at you.
I was just talking actually with our licensing director. This would not be business zoning, it would be residential zoning. So we'll have more answers on that, but it would not go through the same process as what our current group childcare homes go through. But we'll have more answers over the summer.
Thank you, Maggie. I don't know what I'd do without you.
I know, yeah, one of the big issues with the programs that were trying to become group family childcare was towns requiring, paving parking spaces at their house. So it's like, okay, for the half hour each morning and evening.
I know.
Yeah.
One of the hard things is just the local idiosyncratic local process can be really troublesome.
Exactly. It can change from community to community.
I have a question about the prioritization of how you figure out where the new slots will go in terms of, you mentioned childcare deserts. Does that have an additional filter of income? Is this where families are unable to access care and also where they are typically below $100,000 a year? Or is it just communities where care is hard to find regardless of income?
No, it's both. we have and it's actually on our website. Maybe someone can put it in the chat from OEC that shows we combine desert with high need. It's not one or the other. Each gets 10 points, so if you're a high need, high desert, you would get 20 points, highest need, highest desert.
Okay.
But if you're, say, high desert, low need, you might get,
10 points or
10
whatever.
or
Yeah.
11. Yeah.
Okay. All right, that helps. I think you said some version of that before, but I didn't understand it that
Yeah.
way. And do you have any idea when, I know this is like years out, but if that is the priority, do you have any sense of how long it takes to fill the slots that are both high desert, high need before we get into the place where either or becomes available? So I'm thinking about, like, we've got 2 levels here. It's up to 100,000 is free, no parent fee. And then beyond that, it's 7% parent fee. At what point can we expect parents who are in the 7% above 100,000 range to actually begin to utilize these slots? Is it 10 years out or 2 years?
Oh no, I think immediately there'll be some parents over 100,000 using these slots. If you look at where RFA A and B went, yes, they were heavily populated in the highest need communities, but there are census tracts in communities with high needs. There are other things you get points for, like the teacher credentials, accreditation. So, you could get someone that has a 5 in the need and a 10, say a 7 in the desert, that's accredited, has teachers with credentials. There's all kinds of variables going in. So I don't have we believe we'll start moving out of the highest need communities in part in 2027 because poverty has moved to the suburbs. Poverty is not as concentrated as it once was. But we still have to start where there is concentrated poverty. But because Connecticut has been placing programs in those communities since the mid-90s, well, really since the 60s, there are options there now. There are some good options there now. And that's where Head Starts are. So, it's the need will just go out and out and out. I mean, programs, I think we have, how many communities were funded in RFA A and B? I want to say 80 communities or something like that. We can get you that number. But don't think you're not going to be part of the system because you're not in Hartford or New Haven or Waterbury. They will get a lot of spaces, but there are other spaces.
Yeah. And I know we've only, are you guys here till 10:30?
10:30. Yeah.
I meant to ask you that at the beginning.
That's okay.
But I assumed. So we've got 8 minutes left. I know we've been going a lot into the nuts and bolts. I want to step back, and probably we should have started here. But when I was looking at, I was dreaming about how significant this is.
I know.
And I was thinking about, one of the things that we talked about as a team was, okay, well, here's what this state is doing, and here's what this state is doing. And it seems to me that when I look at what all of the other states are doing, they all have bits and pieces, but we actually cover all these bases that, if we look at the DC model, well, we're doing what they're doing. If we look at the Vermont model, we're doing it's like there's all these different states, and we're maybe the only state that now has this sort of comprehensive, we've got, facilities and birth to 5 and this portal and slots and the cap on income, health insurance for, wage parity, the fund, like all of these pieces to me feel like what every state would dream of having. And I'm curious, one, am I wrong? Are there other states who are doing this better than what we'll have in the few years once this kicks in? Of course, we know Connecticut's great. So, but that's one piece. But also, what are we missing? Is there anything that we haven't tackled? Because I know how important this community really said, don't bother with parent affordability if you're not also doing teacher wages. Don't bother with that. It's great that you make it universal, but if it doesn't include infant toddler, then you've ruined the system. And we were able through our advocacy to expand this to include, I think, all of the bits and pieces. So I'm curious if you see that we've missed anything. What's next? Is there anything next, or is it just improving on this?
Well, let me start by saying this is the most comprehensive early childhood bill and system in the country by far. And I think, again, as I started, you all have so much to do with that. It's hard to fathom. I'm having a hard time, after 40 years, being in the field and working in all kinds of jobs in the field, to think it's like we caught the bus, like that joke about the dog caught the bus. What does a dog do when it catches a bus? There's so much work to do. I think what it's not missing what we need as an agency and as advocates. We need to keep communication up, because when we talk about how huge it is, that means it's huge to implement.
Mhm.
It's huge to make it work the way we want. The huge piece to me is Governor Lamont's decision. And he called me and said, hey, if we did this, we could have a sustainable early childhood fund. I was at the Gastro Park with my granddaughter for breakfast. I'll never forget it. Called and said, hey, and that's where the Blue Ribbon Panel, like he knows, he read that. He read the return on investment. We convinced him this was important. But the funding strategy sets us apart. The only other state like us is New Mexico. But their system does put the money out there and it's almost like they take care for kids and just, explode that. But they don't have the structural pieces that we have around having a system, a state system, because we learned in COVID that the state system was was stable, because if something goes wrong, there was that backstop for programs to keep getting funded. And we found that family childcare providers were part of what stayed open and supported. And then we're like, well, we've got to add them to the system. Adding family childcare to the system is very unique. So there's so many pieces here. I do think what you said, Izzy, that sets us apart is we said we have to do wages and affordability together, and we have to do those before we expand the system any further. And if you even if you look at the states you talked about, like our definition of universal is school days. So it's school day, school year. That's like 40 weeks, 6.5 hours a day. Vermont's is 10 hours a day. Most states,
10
their
hours a week.
universal is,
10
so
hours a
this is
week.
just preschool. It's childcare.
Yeah.
So I think it's huge, but it's going to take continued commitment. The work has just started. As much as we feel like we accomplished something, there's so much more to do to help us stay on track and get it right and give us grace. This is a huge lift, and our team at OEC has been working so hard to listen and try to get this right and try to provide TA, et cetera, get information out. But we need prodding, we need understanding, so I think it's just the partnership has to continue. That was way too long, sorry.
No, that was great. I'm actually going to turn it over to Ava, who has a question and hasn't had a chance to ask one yet.
Hi, Ava.
I actually did not have a question. I just had a comment to echo the commissioner's comment on expanding the system. We could be in a scenario, 5-7 years down the road where we ask for a lot more infusion of cash that's put into the endowment. And then that money or the surplus allows us for more infusion of cash that's put into the endowment, and more money means more availability of slots. So while we are expanding, like the commissioner said, in a rate that's sustainable, because OEC is not filled with robots. These are real humans making this happen, and things take time while you expand the system. I don't want anyone on the call to think that the advocacy is closing the doors. It's opening doors, and it's going to be a slow and steady to try to expand and make sure that everyone has opportunity to have access, and that goes hand in hand with money. So leave a little bit of hope and room. So if you're a provider in the next few years that might not have some slots available in your space, in the first year of this program, it doesn't mean that's forever.
All right. Commissioner, I'll let you have the last word before we wrap up on this segment.
My final word is muchas gracias. This is a great partnership.
Yes, terrific. And you're right. I mean, listen, if folks think that it was the Blue Ribbon Panel, how much work did everyone here do on that?
Exactly.
It was even like these calls, which we started out during COVID to keep everybody safe and healthy. Like we can go backwards. It's the work that Meryl and Ava and others were doing ahead of that. Commissioner, when you were a senator, there's so much. Maggie, I mean, this group here has had, I don't want to keep going, but if you go back and back, Maggie's been in this for a
Centuries,
million years.
centuries of work.
Elena, like, this is
Way back.
way back. We've, this group here has worked with many different hats. Actually, Michelle Cook, when you were like, all this groundwork was laid by so many of the folks here and so many that like are not on camera today. But just, again, today is the clapping and back tapping, and then we have to get back to work soon. So but this will be signed into law on Tuesday. Very, very
No,
excited.
no, it's not signed into law on
Excuse me,
Tuesday.
signed by the governor.
No, it's a celebration Tuesday.
Oh, it is?
The bill
Okay.
has to go a lot of places before the signing, it has to go through the secretary.
right.
The bill's not ready, but the governor wants to celebrate. So the recognition of the passage will be Tuesday morning.
My apologies. Thank you for that catch. I definitely thought it was the bill signing.
Yeah, I know, for good reason.
Yes. Okay. Sorry about the confusion, folks. There will be a celebration tomorrow morning. And I don't know. We'll share out pictures and all that kind of stuff, because I think it's a small space. Not everyone's invited, but stay tuned and wait for information on that. Anyway, thank you so much, Commissioner. Thank you for the Office of Early Childhood team, Elena, Maggie, Michelle, all the other folks who are here. And we will do a couple more updates before we end for the morning. So thank you so much.
Thank you.
Yeah. So everybody else, don't go away. We still have a few important things here.
Yep. Meryl, I'll go to you first.
So I know that Joanna Meyer at Peer had asked to be able to talk about a survey they're doing on Care for Kids provider, or of Care for Kids providers. Joanna, you want to?
Sure, I am here. I don't see myself, but can you hear me?
Yes, we can.
Okay, great. So we did a survey of early childhood providers in Connecticut, not just Care for Kids providers. We're really interested in hearing from all different sorts of folks, because we want to understand why people do and don't participate in Care for Kids. We're doing a study of how the policies of the state around Care for Kids promote participation for providers and for families. So we have completed that survey. We really appreciate everybody that participated. We got well over 400 responses, which is awesome. We got responses from center-based folks and from family childcare folks. We are focusing on licensed providers, not licensed exempt. And our next stage now is we would like to interview up to 50 people, so we can go a little deeper and actually have a one-on-one conversation about your experiences with Care for Kids or your perceptions of Care for Kids, and how you decide to participate or not, and how you manage payment processes. So in a moment, I will put in the chat a little blurb about this project and a form that you can fill out if you're interested. Specifically, we're looking for folks who are involved in that decision-making about whether or not to participate in Care for Kids and how to manage the payment processes. And we're looking for one person per provider, so that we have representation of a bunch of different providers. There will be a gift card for everyone who is interviewed, and that'll be a $75 gift card. So again, we really hope to hear from people from programs that participate in Care for Kids and programs that don't. We want to hear from programs all over the state in all 5 Care for Kids regions. We want to hear from family child care providers and center-based providers, the major types of licensed providers. So that is what we wanted to share. Anything else I should say? And is it okay to put that in the chat?
Yes, please put it in the chat. I think you'll have, you may fill your quota today.
That would be awesome. Thank you so much.
Right. Thank you. Meryl, did you have other announcements?
I think just we should all be mindful of the fact that the funding mechanism for this endowment is the unappropriated surplus. And for folks who are rolling like, wait a moment, I thought we were always fighting for every crumb. How is there a surplus? That primarily comes from one of the fiscal guardrails called the revenue cap. What that says is that every year we figure out what our budget's going to be, and we figure out how much revenue we need to cover that. And then we need to build in a 1.25% buffer. So if, say, the budget is $25 billion, of course, now I'm trying to do math in my head. You have to budget for $25 billion worth of revenue, but now you actually have to plan on that plus another 1.25%. But the appropriators never get to see that money. So that money is, the taxes are raised or are implemented. That money goes into a savings account that is there in case there's a big, recession or something. And that money has to get pulled out of that revenue cap fund. It's to deal with it. It's sort of a second savings account before you get to the rainy day fund. And it is just a one, each year it's there, and then it goes away at the end of the year. It gets put into the rainy day fund, or it gets used to pay off debt early. Now what we're saying is that money, plus any like extra tax revenue that came in or any savings the state had, all of that money will get wrapped into the endowment. However, we have some storm clouds at the federal level. As you've probably heard, the Congress is now considering a budget proposal that would slash Medicaid, slash SNAP, and make a whole lot of other cuts to things that the state is going to have to decide, what are we doing about this? Are we letting all these people lose their health insurance, or are we trying to cover it? Are we going to let all these people go hungry, or are we going to try and cover some of that? Those things will all impact the state budget. They could blow a huge hole in our state budget. And we could find ourselves in September looking at, how do we close this hole? And are we taking all the money that we would otherwise be putting into the endowment? So that's something that we're all going to need to work to educate legislators. A lot of legislators don't understand where this unappropriated surplus comes from. And they don't associate your program that may be one of those early start programs with the endowment. We're going to need to educate them between now and September. So particularly if you are currently an early start program, or if you are one of the 700 programs that applied for early start slots, most of whom did not get funded. If you are interested in hosting a visit with your legislator, please let me know and I'll help you organize that. I'm just going to put my email into the chat. Drop me an email and we will start helping to get that organized.
Thank you so much. Ava, I know you've got updates, but very quickly, I wasn't going to say this, but the cat's out of the bag and it's your birthday. And so we're just gonna, from this beautiful community, wish you a happy birthday and a wonderful day and a wonderful week. And now you can give your announcement.
Thank you. I wanted to remind folks that on next Wednesday, June 18th at 6:30 p.m., Childcare 4CT has our monthly community meeting. We usually take a summer break, so it will be the last community meeting for this for this, I guess, cycle until typically we start up again in September. So we'll take a 2-month recess so we can regroup. But the community meeting is important because many of you have family members, have your own parents in your childcare spaces that want to know what's happening with all of these legislative changes. They might not have access to the talking points we did, or any of the information that the Alliance did during this legislative season, and they're wondering, right? So we are going to have legislators who worked on the bill come on our community meeting and do more or less what the commissioner and her team did today, and give a rundown of what was passed, what does this bill do, but from a parent perspective. So please share the date, June 18th. That's Wednesday, June 18th, 6:30 p.m. Anyone is welcome, but we're going to go a little heavier first on the parents and then highlight the provider victories for the different legislative bills that were passed this session. So hopefully we'll see you. We'll also share some photos of the pictures that we took with legislators to thank them and to acknowledge them. And then the other announcement we had or have, summer season, one of the reasons we take a summer break from meetings is because behind the scenes, we really take the time to regroup, look at our strategic plan, figure out how we can better communicate with providers, parents, and advocates. And part of that, you know, regrouping and strategic planning is finally formally launching our advisory board. So for Childcare for CT, last year, our board took a governance vote to make sure that we had more community voices, parent voices, and provider voices really shaping this organization. And we want to make sure that we have that in place. So if you are interested in being part of the advisory board, there are stipends that come with that role because we want to make sure that your time that is very precious is compensated. But if you are interested in being part of the advisory board, please contact me directly. And we're going to be convening and starting that conversation this summer. With the hopes that by next legislative session 2026, we have a board together really shaping what the next few years of this organization looks like. The mission has always been to transform childcare. To echo Meryl, the funding source for this new program, depending on what's happening on the federal level, can be a little volatile. And we don't want to undo all of the work that we just did to get here. It's monumental. We want to add to it. So in order to support that work and make sure that we're preparing legislators for what is to come, we want to make sure that the next few years of Childcare for CT really emphasize on the money so we have more accessibility. And when we hit a point where we've done as much growth as we can in the sector, then we will sunset and hopefully leave it in the hands of OEC to continue their implementation. In the meantime, your voices have value. We want you to be part of this next phase of what this coalition looks like. So let us know. Again, Wednesday, the 18th, for a recap on what happened in the legislative session. And then let us know if you're interested in being part of the advisory board. Thank you, Izzy.
Thank you. And so that's for Childcare for CT. As a reminder, with these calls, we do take some time off in the summer as well. It won't be the full summer, but probably most of July. We'll be figuring that out soon, and we'll get you, or like whatever. I don't want to even tell you what weeks. We're going to figure that out in the next week or two, and we'll get you guys a full calendar so that you can plan. But as always, we will reserve the right to have an emergency Monday call, even on an off week if something exciting or important happens. So, so just save the time slot. Don't give it up. Okay.
Yep.
We do have something going on next week though. Meryl, do you want to talk about that at all?
Yeah. Okay. But let me first, before I get to that, I just wanted to say that I put into the chat a couple of chats back, a couple messages back, the link to the information about those Care for Kids interviews that Joanna talked about earlier. So if you click on that, you can get all the information. So yes, next Monday, we will have a program on early literacy that's brought to us by the 359 Project that will feature folks from Read to Grow and another group that I'm confusing the names, but a good program on early literacy and how to promote it. Okay.
Okay. All right. Well, there's just also to stick on your radar. Oh, wait, is that the, let's see.
Oh, reach out and read. Yes.
Yes,
Read to
okay.
grow and reach out to read, yes.
And just to put on your radar, back at 10:40, I popped in the chat. There's a kudo board, which is literally just like a very fun, sweet way to say thank you to lawmakers. So if you want to click it, you can see what other people are saying too. It's totally lovely and inspiring. But if you have a chance to just, it takes all of 20 seconds to put something in there thanking. We're going to send that out to lawmakers this week, thanking them for their attention to childcare this session. So, you know, if you can put something on there, the more the merrier. I know that that will be appreciated. Okay, fantastic.
Put it back in, Izzy. I'm looking for it, but it could be if you switch devices.
Oh yeah, I'll share it again. Is that what you're asking?
Yeah.
Yeah, I can share it again. All right, thanks everyone. I think that's it. Thank you to the Office of Early Childhood for being here today. Thank you, of course, to all of you for being the reason we have these, to Sandra for providing interpretation to us today, and we'll see you next week. Thank you.